I don't know how to follow all of that, really, honestly, both really inspirational. And thank you, Hannah. And again, just to reiterate, thanks to Hannah, Melissa, and the team for organising all of this. Hannah, Melissa, do you want to just confirm for me that you can see my screen and that I'm unmuted?
Yes, confirm.
Great. Thank you very much. Okay, I am presenting on behalf of my team, and I have, I think, at least 4 of them on the line with me today, as well as the chair of our accountable body. So thank you to all of those, and I hope I do you justice. So I'm just going to start with a little bit of an introduction, a little bit of context really around the children's community and why Wallsend. Back in 2014, following the removal of extended schools funding, schools knew that they needed some form of wraparound support beyond the school gates. And they could also see the decline in statutory provision. And through a series of very fortunate meetings, I would say, the chair of the schools partnership, which had 15 schools in it, in Wallsend, was connected to Save the Children UK. Together, they co-developed the next steps, which became the Children's Communities Network, which is 3 children's communities in England, Smallshawhurst, which you can see is in Manchester, us in Wallsend, and then we have, both of those are hosted by Save the Children. And then we also have the Pembury Children's Community, which is hosted by Peabody Housing. Save the Children brought funding and funders. They host us as staff members. They brought profile and a national evaluation through Sheffield Hallam University. Whilst in the locality, they brought the partnerships, local intelligence, and some topic-specific research. The funders that came on board at the time did so because they were interested in what a children's community could potentially offer. And I guess we're in a position to patiently invest, and I do mean that, patiently invest. I think they were all naturally curious funders who wanted to learn, and I'll tell you more about who they were as we move through this. But I don't think anybody knew what they didn't know, so this has been a real collective learning journey. Wallsend Children's Community, all of that happened over a 2-year period, and then finally Wallsend Children's Community was inaugurated in mid-2016. So we're really only 4 weeks in, or 4 years, it feels like 4 weeks, into our work, which, trust me, has been a very movable feast. But why Wallsend? Well, Wallsend is located about 3 miles from Newcastle city centre in the local authority area of North Tyneside. It's a rather large geographic area. It's 4.2 square miles, and it has 44,500 residents, of which 11,000 are aged 0 to 19. Over 4 wards, it's got 5,623 households with children, of which 3,437 live in poverty in accordance with the government's definition. And that level of poverty really is a legacy of the demise of shipbuilding and other engineering and textile industries in the area. So, a children's community. What is a children's community? This is our theory of change. But what a children's community is it's a geographical area of a community that puts children and young people first. It's made up of everybody living and working in that area, and it belongs to the area. But it's supported by a core team and an accountable body of local stakeholders. And our role collectively is to bring all of the agencies that have a vested interest in children, young people and families to support a much more collaborative way of working that is child-centric and sees the whole of the child rather than individual lenses. For example, education or health or early years or health visiting or social work, for example. But you'll see here from our theory of change that our vision is to change the odds for the poorest so that Wallsend becomes an area where all local children and young people have access to exactly the same high quality chances. And you can imagine that is not something that you can do over a 3-year project or a 5-year project. It is over a generation, so it really does require that patient investment. You can see here also that we framed this with our system across 3 core themes that cover the whole of the 0 to 19 lifespan. In terms of the role of the core team and the accountable body, as a core team, we actually have a clearly defined theory of change. And this has been aided by a huge amount of work that we've done, particularly over the last year, as we now have a full complement of a team. But through our work with Northumbria University, Melissa, Toby and the team, we have coined the new kind of systems steward idea of how it is that we work. And through Dartington Design Labs, we produce this theory of change. Effectively, you can see that our role as system stewards really is to build the capability for community and system co-design. And we do that by providing local intelligence, collective intelligence and insight, and working in a human learning systems way. And what I mean by that is, in terms of human, we see as a collective the child as a whole, and that child not being distinct of their context or environment. So knowing that in any one specific lens, there are so much other influences over that child's life. But human also, in terms of building that capacity, is about building relationships, both within the infrastructure of agencies around the child, but also within our communities. In terms of learning, we have constant sight of the system and what's happening across our partners, of the community itself, of the context, and that being local, regional and national. We undertake research, again, locally and nationally, and we bring insights from other areas of good practice into the Wallsend area through our partners. In terms of systems, well, systems is everything, because a child is not distinct of their system. So we ensure that all of our partners are continuously cited on any changes that are happening across the system. So for example, where there might be duplication, which we found quite a lot of, where there is connection between the schools and the community, bringing diverse stakeholders together, all with different lenses to focus on child, providing support for the development of new ways of working, providing seed corn funding to pilot new initiatives, and then underpinning expertise to support the development of local strategies and theories of change. For example, a play strategy, an oral health strategy, and a theory of change on transitions between primary and secondary school, for example. And we do that by triangulating between the community, the practitioners that are out there on the ground, and then strategic and operational leaders across the area. The core team itself is made up of 3 individuals, myself as the executive lead. My primary focus really is on the strategic and operational leaders. Emma, who's our community coordinator and on the call, thank you, is her primary focus really is on practitioners, those on the ground working directly with children, young people and families, and on communication. And then Darren, who's also on the call, who's our widely named Data Evaluation and Impact Advisor. He's got the longest title. But his focus really is on evidence research and evaluation. We are delighted with the relationship that we have with our funder, who also saw the need for us to have a community connection. So we also have 2 community researchers on what we call Story of Place project, and their role really is to gain that depth, that beautiful richness and depth of community insight, and to develop some community capacity. They are funded entirely separately. So just in terms of funding, here's our funders. And these were an alliance of funders that were brought together by Save the Children at the outset of the Children's Communities Network. Some of these funders specifically wanted to support the evaluation, the national evaluation of the programme, to see, you know, what difference children's communities could make and whether the principles of it could be underpinned. And others then funded the core teams along with some CCORM funding, so that each children's community gets 15,000 per year to seed some new initiatives, pilots, different ways of working, etc. within their area. And then we also have a very modest local budget of about 6k, which supports us for events, consultancy, equipment, etc. That alliance is primarily managed by Save the Children's philanthropy and fundraising team. The anomaly in that is the Ballinger Charitable Trust, who are a local funder, and they have really a direct relationship with us in Wallsend, and they fund pretty much the core team with some support for Save the Children as well. In terms of funding, though, the challenge for funding systems change programs is that, as I've said earlier on, it is a patient investment. This work is a generational piece of work. It isn't a 5-year piece, it isn't a 10-year piece, so it's high risk. And in that high risk, because it is a longevity program, we don't actually have outputs and outcomes, and we're not project based, so it's quite hard to define what the metrics or KPIs might be. Relationships, though, are everything, and I'll talk specifically about our relationship with the Ballinger Charitable Trust, because they've been with us since the very, very beginning. And despite being with us since the very beginning, we're 4 years on, it's really only in the last year that the penny is dropped for them about what this work can achieve, what its potential is, which demonstrates actually the level of risk that they're taking in providing funding for this kind of a project. But they were aware that they needed to fund something upstream, because a huge amount of their funding is very local and grassroots and downstream. So it's pretty much crisis and very grassroots voluntary organisations up to about 5k a year. So funding us is a completely different thing for them. What they're aware of is that crisis work is really, really important, and they also know that preventative work is really important. But actually, systems change work is neither of those. And without a sustained cultural shift to more collaborative and holistic work, and that is both research and evidence-based, they know that money will eventually run out. So our relationship enables them to support a more strategic approach to their own funding based on the insights that we offer around the way in which the system works, and more specifically locally, who's doing what, how, where, and how their funds can best be targeted. In terms of our own funding, in 2019, Save the Children reviewed their mission and concluded that their focus was really on 0 to 6, which means that as an initiative focusing on 0 to 19, technically we no longer fit with their mission. So we have funding that current Funders Alliance funds us out to March 2021, but we're now seeking both a new host and funding for at least the next 5 years. And we couldn't have picked a better time to do all of that, of course. But in terms of those relationships with funding, they are critical so that they understand our work and its impact over time. And I think the things to think about in terms of systems change and funding is that there aren't outcomes. It isn't a project. And I think it's a question that's already come up today. There's a huge amount that's not within our control. So you can make the core team accountable for certain things, but ultimately we can't control it. We are at the behest of the system most of the time. So we can do research that guides what happens, but then we start working with partners and unearth more insights, which means that we need to change what we were doing or how we were doing it. Stakeholders, we put an enormous amount of time into developing relationships, but people come and go. And when they come and go, all of that enormous effort and time that you might have put into building something to ensure you've got real-time insights suddenly in an organization can seriously disrupt work that's been in the making for quite some time. The way that organizations are funded also affect how they commission, and that has a significant bearing on how they work. It takes time and patience to shift culture, and there are no metrics or KPIs for measuring that. It has to be based on trust. And core teams have to have integrity and authenticity in everything that they do, because they hold a very delicate balance between partners, hosts, and funders alike. And then there's also a child in the middle of all of that, of course. Just very briefly, in terms of Corona and what we've been doing, we've been really, really blessed that we are 4 years in, so we have quite a good traction within the system already. So we've worked across the area with partners to very quickly gain sight of what everybody's doing, how and with whom, who's shut down, who's ramped up, who's shifted onto line. And we've started sharing this across the system to ensure that there's no duplication of effort, and that funding is targeted in a really effective way. And we've themed that in terms of issues that need to be addressed and who's working with each of those. For example, free school meals, youth work, what's happening in the home learning environment, mental health and well-being, domestic abuse, bereavement. There's so many things that surround a child that we need to have our eyes on. We have galvanized our partners and sourced funding to underpin effective systems or platforms that will provide a legacy beyond COVID. We've developed a series of surveys to ensure the fullest understanding of need that both tell us about the now need, but also direct us in terms of the future through and beyond COVID. And we've connected a wide range of social media platforms to gain community response and insight, and again to establish clear need and build a picture of what needs to happen in the future. Darren, bless him, has been brilliant at underpinning all of that with significant research. And I suppose more pivotally, we are also charting the story of systems behaviour as we move through all of this. In terms of funding, well, our relationship with the Voluntary Charitable Trust has been really, really essential here. And that has moved. He has supported us hugely with an immediate response, and thinking about where that immediate response needs to go. We've helped to direct that charitable trust. But they also have, whilst they want to do an immediate fund, they also have an eye on what the medium term is going to be over the summer, and a longer term once all of this is gone. And that insight has been hugely informed by their work directly with us. They've also helped us to strategize with other funders to look at how we develop funding combinations for our partners within the system and how we connect them with funds at this time. And then, but in all of that, they remain incredibly concerned about the future of our type of work and patient investment, specifically at this time, because I'm sure there are other funders on the call right now, but I know that they've had millions wiped off their funding investment, and they're going to have to make some very, very difficult decisions moving forward. And as Andrew put it to me himself, they are very tempted to fund right now that which is drowning and obvious in, I suppose, in place of funding the medium term and the future. However, there is hope. There has been no other time in history that provides a stage for demonstrating the power of a human learning systems approach than now. We aren't frontline workers, but we do support an infrastructure. And if we get that right in our immediate responses at the moment, we will have underpinned what the methods are that are going to allow us to continuously gain insights to inform latter responses when people do start to socialise again, when kids do go back to school, when businesses reopen, and when communities start to function. We've seen a command and control response, and we understand that hugely because of that systems insight. We've also seen some organisations retrench, but more beautifully, we've seen lots of partners want and value each other so much more because they know that together they are so much better. And they've come to us to help to support all of that. Hopefully, funders will also see that story, and knowing that they have diminished funds, will value those systems insights even more, so that they're able to target funding based on those rich insights and those relationships into the future. That's me for now.